Hello dear patients, today we are going to review the case of relapse of white vesicles on the penis. A young man came to see us. He had burning, itch and vesicles in the area of penis. He consulted the dermatovenerologic dispensary at the place of living. There he had been prescribed, without any analysis, first hormonal ointments by type of triderm without any effect, then antiherpetic ointments by type of acyclovir, zavirax, etc. After these rashes disappeared, they reappeared again. What needs to be done here? There was one video about how the analyses are taken correctly. It is necessary to take PCR analysis from the surface of these rashes. First of all, for three types of herpes. These are first, second and herpes zoster. Sometimes even cytomegalovirus is possible, therefore it has to be remembered. This young man also had analysis taken from the urinary canal for all genitourinary infections. A second type of herpes was found out, that is a genital herpes. Blood tests for herpes type 2 were taken. Immunoglobulin G was positive, immunoglobulin M was negative. The concentration of immunoglobulin G was 1.3, which is only higher than dubious value. That means a low concentration of such immunoglobulins. That is basically the level of body resistance to herpes. What needs to be done in this case? First of all, antiherpetic medications are needed. These are acyclovir, valacyclovir and other medications that are prescribed in standard dosages. Apart from that, what needs to be done for treatment is to take immunogram, to do immune treatment with immunologist. After that, vaccination against herpes needs to be done after some time. That is, to try everything that is possible during herpes relapses to make the body able, as much as it can, to resist this herpes virus. It has to be remembered that vaccination works well in some cases, and the immune treatment helps to produce the required immunoglobulins. Therefore, about half of patients with chronic herpes are able to finish the treatment on this stage, or to make the number of herpes relapses quite rare. Also, if these methods did not work out, then a constant intake of different antiherpetic medications is recommended. Constant intake is the third line when nothing helped from normal methods of treatment. I don't talk here about the anal treatment, which is used when a couple of suppositories is inserted into anus. Out of these methods of treatment, neither vaccination nor immune treatment helped. That means the body does not resist herpes good enough. In this case, there's only one method, that is a constant or periodic intake of such antiherpetic medications as acyclovir, valacyclovir and others. Therefore, it has to be remembered that it is necessary to take the tablets. However, it is necessary particularly during the initial period when the disease just starts, or if it becomes chronic, to try methods that do not carry any global problems, but they can bring a sharp decline of relapses frequency or absence of relapses for quite a long time. It is also necessary to remember that for such patients, particularly the ones who have herpes on buttocks, thyroid hormones have to be checked, as often herpes triggers the autoimmune process, so that is quite important. As I mentioned before, herpes activates some mechanisms of immune system that are aimed at the body itself. Therefore, herpes is dangerous not only because it has external rashes, but also by its internal changes of immune system. Therefore, in such patients, this approach is needed, and not only the external one with usage of different ointments. Diagnostics as well as a full-scale treatment is needed not only from dermatovenerologist. If it is necessary to diagnose and treat different rashes in the area of genital organs, you can consult the venerologists and urologists of our medical center of paid dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on Instagram and YouTube. Thank you for your attention.